Mimi Syed is an emergency medicine physician. She joins me now live from Olympia in Washington. Great to have you here with us on TRT World. Of course, we have been talking about the worsening humanitarian situation in Gaza since it all started. But it seems to me, as the Secretary General of the United Nations has also said, that this is perhaps the cruelest phase of the war.
Hi, thanks for having me. Yes, this is quite far the worst I have seen and what my colleagues are witnessing currently on the ground. The situation I never thought could get worse than when I left in December. I was also there in August, and I thought the same, but it just continues to get worse. The healthcare system is completely broken. I am not even sure how the healthcare workers are continuing to show up at work, and mostly as volunteers, but just today, a pediatrician's entire family, a pediatrician that worked at Nasser where I was stationed, her entire family was killed. All of her children were killed. Her and her husband are both physicians at Nasser Hospital, and it's just the most devastating thing you can ever imagine. But now you add on top of it, my colleagues tell me that they are barely eating 250 calories a day. And as an adult that has such a physical toll on them, that I just can't imagine what that's like. And it continues to get worse. The aid that's been allowed in is nothing. It's spitting in the wind, and it's almost a joke that they consider this entry of aid, because we all know this is not enough.
Right, and Mimi, I understand that you have volunteered in Gaza twice as a physician, and you have contacts over there. Let me ask you, what are your contacts telling you about some of the most urgent needs of Palestinians right now? What is the most urgent?
I mean, the biggest elephant in the room is the bombardment, right? The airstrikes that are basically, there are no safe zones in Gaza anymore. I mean, even formally, there are none. Everyone has been told to evacuate. Just up to, half a kilometer away from Nasser Hospital is an evacuation zone. So there are no places to go where you can be safe. So that is the biggest threat right now to most lives, including mostly children, as we know. More than 50% of the population are children. And that's who we saw there. That's who we treated, civilians, children under the age of 12. And now I hear, and we've been hearing this for almost 3 months, is there is no food that has been allowed in. And malnourishment and the death from starvation is an imminent threat. Many children have died already as a result of starvation, and many more are at imminent risk of dying further.
And Mimi, this is something that I believe many are bringing up, or perhaps talking about, even though that we know that what's being brought into Gaza right now in terms of humanitarian aid is a drop in the ocean. Let's assume for a second that the needs of Gazans were being met and more aid is being brought into the territory. But even then, when we look at the long-term impact of Israeli blockade and Israeli onslaught, certainly in order to recover from that, it's going to take years, perhaps decades.
Absolutely. And that is the biggest issue right now is, all of this physical violence in front of us is so important, and it's so powerful to see those images. But what we don't realize are the long-term effects of what the Israeli military has done to the land of Gaza. Agricultural land where livestock and crop used to grow is completely destroyed. There are heavy metals from the bomb, from the buildings that have fallen, the rubble. We don't even know what's in the rubble. No one has been allowed to enter to do any investigation or studies. We also don't know the death toll. No one has been allowed to come in to analyze that. But the long-term effects are very difficult, and they're not tangible on video and images that are coming out, right? Because we don't realize the electricity grids are completely destroyed, the water system, the sewage, all of that is destroyed. So even when you do allow aid in, it will take years to repair, which I am certain that the people of Gaza are capable of doing, but there has to be a permanent and sustained ceasefire. That is the first and foremost important thing. Every person I have talked to is just waiting to die. They know they are going to die. It's just when and where they will be. And the biggest, the wish that people have is, I hope I don't get disabled or injured or maimed. I hope I die with my family. I hope I don't end up alone. That is devastating. The psychological toll and trauma is going to be very long term. And I see that now in my colleagues that I didn't see before, the hopelessness. This is a population that is very faithful and very positive, despite the ongoing slaughter of their people. But even now, I'm noticing, people have lost hope that the world has turned their back on them.
It's truly heartbreaking, Mimi. Certainly words cannot describe the tragedy unfolding in Gaza anymore. Thanks very much for joining me here on TRT World. Really appreciate your taking out the time.